Hello, Ms. Racca.
Good morning, Dr. Krell. Can you hear me? Can everyone hear me?
I can hear you fine.
Great. Thank you for joining us this morning.
Good morning, Dr. Krell. Yes, thank you.
Hi, Mr. Reed. Happy to try to help.
You have been.
I hope you know you have our support as a medical community.
Well, I appreciate that very much, and I've certainly felt that from you and many of your colleagues, so thank you.
I think the message today is we just have to stay the course. We're making headway.
You guys have been busy lately, I know.
Yeah, we have.
For you, so we appreciate all you're doing.
Chairman, I think we're ready to start whenever you are.
Okay, very good. Thank you. Good morning, everyone. We'll go ahead and call this meeting to order of the East Idaho Board of Health meeting for September 3rd. We have members of the public in the meeting with us, and we appreciate your attendance. Of course, we also have many staff members from Eastern Idaho Public Health, including our director, Jerry Rackow, and our epidemiologist, James Corbett. All of them and other members of the staff have just put in an incredible amount of time during this really unprecedented time, and so we appreciate all their efforts. We're also joined by Dr. Krell this morning. We appreciate him being with us, and we'll hear from him later, as well as other doctors and hospital administrators that will also report to us. They have been such a tremendous asset to our board and to East Idaho Public Health as they've provided us weekly updates. And we really hope to and believe that we have a great working partnership with them. Well, first let me say that this meeting is being held with Zoom webinar, and we've appreciated the work that's gone in to set all that up. We also have a meeting room available at Eastern Idaho Public Health Building for any public that come to the location and wish to view the meeting. It can also be viewed on East Idaho Public Health's YouTube channel. We will begin this morning with a roll call of our board members. We'll begin with Madison County.
Present.
Thank you.
Commissioner Mendenhall.
Thank you, Commissioner. Jefferson County
Commissioner Young, present.
and Fremont County.
Don't see him on.
Okay. Do we have Teton County?
Bill Lake, present.
Thank you. And let's see, Lamhi County,
Commissioner Minor, present.
Custer County,
Commissioner Butts, present.
and let's see, who am I missing, Jerry? Well, besides our board physician, Dr. Nelson.
Clark.
And thank you. I knew I was missing a county, and Clark County, Commissioner Shenton.
Yes, Commissioner Shenton, present.
I apologize, Commissioner. And of course, I'm Brian Reed from Bonneville County. Is Dr. Nelson not with us yet, Jerry?
I do see her on the list.
I'm present.
Okay, thank you, Dr. Nelson. Appreciate you being with us this morning.
And then also, Mr. Chairman, Dr. Martha Buitrago is also listening. She is our infectious disease consultant position and available to answer any questions if anyone has any of her.
Thank you, Dr. Buitrago. We appreciate it. We know you've also been with us each and every week, and we do appreciate your support. We'll move on to the next item on our agenda, which is approval of the August 27th Board of Health minutes. They are on our website and were sent out. Is there any corrections or additions that need to be put in those minutes? If not, I would need a motion to approve.
Bill Lake from Teton County. I make a motion to approve the minutes.
Thank
Commissioner
you.
Mendenhall, second.
Thank you. We have a motion and a second. All approve, say aye.
Aye.
And is there any opposed? All right, thank you. We'll go ahead and move on to the public comment portion of our agenda. There were very few comments this week. A couple of questions about Custer County, which will be discussed later in the meeting. And there was also a question came in late last night regarding a homecoming dance that is scheduled for, I believe, Rigby High School. And they just wanted to know if, our stance on that. I guess, Jerry, I was curious as well if you had discussion with superintendents as far as activities. I know they're having games and everything, but I didn't know if dances had been discussed.
Mr. Chairman, we have not had any specific discussions with any of the schools. One school, Water Springs, has reached out to me asking specifically about a homecoming, but no other schools have reached out to us to have those dialogues. I know that particular event, that I was not aware of that. The one that came in looks like it's being held in Bonneville County, but we certainly will reach out to the organizers and just discuss the restrictions that are in place for Bonneville County with the gathering.
Okay, thank you. I will say that from what I've been involved in with schools that I've visited and my grandchildren being in schools, it appears they're trying very hard to have everyone wearing face coverings and to do everything that they can, and we'll continue to support them in that effort. We all, I believe, realize how important it is for these children to be able to be in school. And we just are so hopeful that they can continue to do every practice necessary to make it a safe environment so that that can continue. And so we appreciate you reaching out to them, Jerry. Is there any?
Mr. Chairman, I think we need to make a note that it appears that is not affiliated with Rigby High School. that it is a private concern. I think in the email, it states that it's not affiliated with Rigby High School. And so it appears it is whoever, I don't know who would be organizing it, but it states right on there, not affiliated with Rigby High School.
Oh, I didn't see that, so I appreciate you making that notice. So I'm sure we'll try to contact whoever is doing that and make sure that they understand all the requirements that would go along with that activity. We'll go ahead and move on to the next portion of our agenda, which is reports from our hospitals, particularly regarding ICU and overall capacity. And Jerry, which order would you like to go on this?
We'll just go out as we have it listed on the agenda. We'll start with Casey Jackman from Idaho Falls Community Hospital. And before Casey starts, can we just make note that Commissioner Miller, it looks like he has joined us.
Okay, welcome, Commissioner. Thank you.
Thank you.
So, Mr. Jackman, thank you.
Thank you. Appreciate you having me. Just a quick update compared to last week. We do have half of our ICU is full. Only one of those is a COVID patient. We currently have 3 patients on ventilators. None of those are the COVID patient. On the algorithm that I keep mentioning, we have seen a 58% increase over last week, but that is predominantly non-COVID. The only additional patient we have this week over last week is the ICU patient.
All right, thank you. And we do recognize that that's a lot of the importance is for us to, keep the COVID numbers low enough that you can treat all the others as well. So thank you for that report. We'll go to Eastern Idaho Regional Medical Center, Mr. Hoffenberg.
Good morning. Can you hear me?
Good morning. We can. Thank you.
Great. Well, to give you a quick update on our current numbers, we are seeing, hospital-wide, not just within the COVID space, we are seeing a little less patients than we had. In our ICU, where we are a little over half of our capacity available, filled, and so we're seeing traumas and some of those more high acuity patients not coming in as much as they were. We are sitting at 13 COVID inpatients, so we are down from last week, which is positive. But we have a number of PUIs in the facility, so we are still relatively active when it comes to our COVID population and patients that we're treating as if they do have COVID until we get their results. One change for us that we have put in place and are continuing to roll out and make sure our staff are adhering to is we are going to universal shielding. And that's a precautionary measure we're doing as a facility to really protect our staff. With schools opening up and going into what we expect to be a very busy respiratory season, we do want to add some additional precautions because with the number of folks in the community that may be asymptomatic and patients potentially coming in that are asymptomatic, we want to make sure that no matter where care is being provided, that our staff are protected, whether that's in the outpatient setting or in the inpatient setting. And so that's something we rolled out in the last week, and we hope will just add another layer of protection to keep our staff healthy and available, because right now that's our most precious asset is our team members and our caregivers. And so I know Dr. Krell and our physicians have been great with helping us, come up with our recommendations to our staff and helping us roll that out. And I know Dr. Krell will speak anymore, so he can add anything else that he's seeing from the provider side at ERMAC, but we still remain relatively active, but things are a little bit calmer than they had been over the last few weeks.
That's good to hear. Thank you.
I would just like to maybe mention that Mr. Hoffenberg mentioned a PUI, and that's a person under investigation. So they could be symptomatic, potentially have a test pending, but not confirmed. So just if you're wondering what PUI is.
Thank you.
Yes, I'm sorry. Thank you.
All right, we'll go ahead and go to Madison Memorial then. Dr. Gonzalez,
Good morning. Can you hear me okay?
good morning, you bet.
So Madison Memorial, our operations are normal. We're at 50% capacity at the moment in our ICU. Now, I feel like I'm jinxing us a little, but we currently have no COVID patients and have not had for a few days now. The only area that is not, our ER just continues to be pretty busy, and it has not slowed down as we usually see after school starts. And I know Fremont County hasn't started until the 8th. What is today? Yeah, next week. Anyways, it's interesting as far as the ER goes. That's still pretty busy, and testing is still obviously very busy for us. And I do know, as David mentioned, a lot of the hospitals, I heard them reporting on different measures that they're working on in the different facilities as far as preparing for respiratory season. Other than that, I don't have anything. Thank you.
Thank you. Does any of the board members have questions for any of these hospital administrators? Okay, well, we want to tell you how much we appreciate the information you provide each and every week. It has been extremely helpful to us, and we appreciate all that you're doing in our communities. I know we're going to hear from you later, Dr. Krell. Is there anything you would like to add now?
No, we have been seeing a little relief because of the lag in the serious cases, the ICU cases that I take care of. We are still quite busy in the intensive care unit. Yesterday, I had to put a patient who needed transfer to the ICU out in one of our negative airflow rooms, which is safe, but we were full in our COVID ICU area. Unfortunately, I had a death yesterday that resulted in being able to move that patient in. So we're still quite busy in the intensive care unit, not just with COVID patients, but with burns, trauma, medical patients as well. But we have seen a breath of air in terms of the census right now.
Okay, thank you.
And I attribute that to the decrease in COVID patients, to the measures that you've taken as a health board, that we are seeing some relief at this point. And I think it's important to recognize that your efforts are paying off.
Well, thank you very much. I appreciate that comment. And that's certainly the reason for our efforts, is to help protect that health system and keep the capacity available there for all patients. So again, thanks to all of you. Appreciate you joining us each early Thursday morning. We'll go ahead and move on to item 5 on our agenda, which is an update and a review of the data. So Jerry, I'll turn that over to you.
So thank you, Mr. Chairman. There's a few things that we want to talk about in addition to the data this morning. And the first prompted my invitation to Dr. Krell for joining us. Over the weekend, or in the last few days, the Centers for Disease Control and Prevention updated their provisional death data having to do with COVID-19. And ultimately, the data is showing that 94% of the deaths associated to COVID-19, the individuals also had comorbidities or other underlying health conditions. Unfortunately, well, and on the flip side of that 6% of the deaths had only COVID listed as the cause of death. Unfortunately, that has led to a lot of misleading narrative in the media, on social media, and I would like to ask Dr. Krell if he can help clarify information surrounding COVID deaths, comorbidities. We get a lot of questions about the reporting that Eastern Iowa Public Health does for deaths related to COVID, and people questioning, well, did they die with COVID or did they die because of COVID? And so I would just like to turn the time over to Dr. Krell and ask if he could help everyone understand the realities of people contracting COVID, those with or without other health conditions, and just how that all ties together. So Dr. Crowell, please go ahead.
Sure. As you mentioned, the CDC has broken out deaths into those with comorbidities and those without. As we've known since the beginning of this epidemic, the majority of deaths, the vast majority of deaths that we see are in patients with underlying comorbidities, be it diabetes, obesity, hypertension, coronary disease, that make them more susceptible to death from COVID. As the CDC broke out this week, 94% of patients had an average of 2.6 additional comorbidities who died of COVID. But as Dr. Fauci had to indicate yesterday after some misleading Twitter comments, make no mistake, those 182,000 deaths that are reported by the CDC are a direct result of COVID-19, that those patients would be alive at this point, living with their diabetes or hypertension or obesity, were it not for getting infected with COVID-19. We simply know that patients are more susceptible to getting COVID and dying of COVID if they have those underlying comorbidities. That does not mean, however, that they died from their diabetes or their hypertension. As Dr. Fauci had to clarify yesterday, make no mistake, those patients would be alive today if it were not for having contacted COVID. That this is not like influenza, either in spread from asymptomatic patients or in the susceptibility of patients with comorbidities to dying of COVID. We know that the death rate is about 10 times the death rate of influenza and results in about 1% of deaths. Fortunately, it's not higher than that. But as Mr. Little said yesterday, we have to recognize that perhaps a third of Idaho residents have underlying comorbidities and are susceptible to death from COVID because of their susceptibility to those underlying comorbidities. But it by no means means that they died from the comorbidities. They died from COVID. I had a death yesterday in a 36-year-old woman who has some obesity and underlying mild diabetes, never required insulin. Make no mistake, that patient would be alive today if she had not contacted COVID, having underlying susceptibility because of her underlying diabetes and some underlying kidney disease that had resulted from the diabetes that left her in severe respiratory failure and kidney failure because of her susceptibility. But she would be alive and in the community today were it not for COVID-19. So we can't confuse deaths from COVID-19 and misconstrue those as death from other causes because they have that underlying susceptibility. In fact, we have been suspicious that we may be underestimating the COVID deaths significantly in the country, because we know that the actual increase in deaths countrywide may be twice what we're reporting from COVID. So a lot of patients may die, have their causes of death listed as a myocardial infarction, when in fact they had the myocardial infarction, their heart attack, because they contacted COVID. So if anything, we're underreporting those deaths. And as I mentioned earlier, I think the improvement that we're seeing is a tribute to what you're doing as a community and as a health board, in that we are seeing some improvement. We're seeing some light in the tunnel. And that this is not the time to slacken those efforts, that as schools open, as we move into influenza season, we need to maintain our vigilance. We are concerned about starting to see influenza, which is a deadly disease for many patients, on top of COVID, We have some hope, in fact, that masking is going to make our influenza season lighter, along with community-wide vaccination. But it's too early to know. It's too early to know the impact of school opening. So our message to you would be, we've got to stay the course, that we're making headway, that what we're doing is effective. And this isn't the time to misconstrue statistics about COVID deaths and to minimize the absolute seriousness of the disease.
Thank you, Dr. Krell. We appreciate that, and that does help clarify a lot of that news that came out yesterday. Jerry, what else have we got as far as update here?
I guess I would just ask if anyone has questions for Dr. Krell. If not, he's welcome to stay with us as long as he'd like, but I know he's very busy as well. So do any board members have questions of Dr. Krell?
Thank you very much, Dr. Krell. We appreciate it. And
I'm going to run to the ICU then. Thanks
Thank you
for
so much
all of
for your
your
time.
hard work.
we wish you a good
appreciate
day.
it greatly. Okay.
Thank you.
All right, this morning we also wanted to just touch on nursing homes and schools. We'll start with nursing homes. Over the past couple weeks, I would say, at least in our health district, we're starting to see more activity related to COVID occurring in nursing homes, whether it's in residents or staff members. Every Friday, the Department of Health and Welfare does release a report of nursing homes, assisted living centers, long-term care centers throughout our state that have experienced cases of COVID within, again, either in residents or in staff. We are having a couple of facilities in our region that have seen an increase in activity the last week. They're spread throughout our health district. And I wanted to let you know that the federal government has provided, I think there are 7 facilities within our health district that have been provided point of care testing machines. They are the rapid antigen testing machines that the nursing home or these facilities, the residential care facilities, we'll call them, will have available on site to be able to do the testing for residents and staff as necessary. I spoke with one of our administrators yesterday, and while they did get one of the machines, the supply of tests is still not known. How many tests they're going to get throughout this process. What they did receive initially is not going to last them very long. But the Centers for Medicare and Medicaid Services has established criteria and regulations for these facilities of things that they're needing to do throughout this pandemic. And part of that is to have a plan in place of how they're going to address cases within their facilities. Along with some new guidance came out just last week from CMS. They gave instruction to these facilities on requirements for testing of their staff, particularly based on the positivity rate within an individual county. We have been in discussion with the Department of Health and Welfare for a long time. That's where we get our testing positivity information. And it looks like they're going to be able to start providing us data on a county level. So hopefully next week we'll be able to see that and share that. But CMS has also provided these facilities with the positivity rate for counties for which they reside. And there's not clarity at this point on where CMS is actually getting that information. It may or may not coincide with our data. So there still are some questions about the level of spread within the communities, but we are working closely with nursing homes. I will tell you that we continue to assist them with getting personal protective equipment and other supplies and material. Our staff work with them to identify their usage rate and then coordinate with the Idaho Office of Emergency Management to get additional supplies to the nursing homes and residential care facilities at the local level. And we've been doing that since early on in this pandemic through the support of Idaho Office of Emergency Management. Are there any specific questions about nursing homes, assisted living facilities, or long-term care centers? I would just share that when you refer back to our plan, it's these type of facilities that we certainly are concerned about having outbreaks in them that would potentially create higher hospitalization rate, because generally the individuals in the facilities are of advanced age. Certainly many have underlying health conditions that we just spoke about. And so the opportunity for severe illness and hospitalization resulting from outbreaks in residential care facilities is substantially higher than just the general population. And so we're keeping tabs on them, working with the staff at the facilities each and every day.
Thank you.
The next thing I would just mention schools, and for the majority of our counties, school is back in session. I think Dr. Gonzalez mentioned that in Fremont County, they don't start until next Tuesday after the Labor Day weekend. We have had some instances of positive students or staff already. One that has been noted and made news is Mackey School District. In fact, last week, the decision was made by the school administration because of the positive cases and exposures to those cases that they closed down in-person school and went to online until next week. But we know that we're going to continue seeing cases in our schools. James and I have at least weekly conversations with the school superintendents on Thursday mornings, but many more conversations one-on-one throughout the week as situations arise with the schools. It's certainly going to be challenging for them, and we're providing the best recommendations and assistance to them that we can. But we'll continue to update on schools each week as things progress. With that, I would I'm going to pull up our data dashboard and let James talk about the response plan metrics and data. So give me just a moment.
I'll just say, while not directly on the response plan metrics pages, we do track testing turnaround time, essentially, or the average test that we've seen on the last 7 days. We update that each Wednesday. It's found on the overview page at the bottom. So it has gone up slightly this week to 2.9 days from 2.8 last week. And that's anecdotally, we are seeing just a slight increase in turnaround time, mostly from some national reference labs. Specifically, the cause we don't know, but kind of going from 2 to 3 days to 3 to 4 days. So we'll monitor that closely. Continuing on with the response plans, you can see the counties listed again here across the top with their rates. You'll notice if Custer County corresponding with what Mackey saw last week and continuing in other areas of the county this week to a rate of 37. Bonneville, again, being right there. We can go through the individual counties if you desire. Just below that, that doesn't say much. That's just a one-day picture. So really looking at different rates here. I will say that we have had a number of deaths in the last week to 10 days, really. Yeah, and we'll show you that in just a minute, but I want to highlight Bonneville County here, but overall for the district, we really did you can see a slight peak in the number of cases in the first part of August, those first few weeks in August. And where we did see the deaths, we'll talk about this more in a minute, we did see there was more towards the end of August. So there is a lag time between sometimes the number of cases and the severity that we see, or the outcomes that we see from that, both with ICU and with deaths. And that's proving out here as well. Each of the counties we can see, we can look at, but this is Clark County. We've had some discussion about this, well, there's still a high rate, as we indicated last week. If they didn't go above the 50 per 100,000, we were okay. They've had a few sporadic cases, but most of again, their cases were centered around the first part of August, that first half of the month. This is Custer County. You can see a sharp increase actually towards the end of the month, starting last week a little bit, and then continuing on the last few days. So their active rate has increased dramatically. I will just call a note on Madison County. We have seen a slight increase, kind of from a baseline up. It's getting closer to, and we just encourage all individuals to continue to take those recommendations that we do on a regular basis.
Fremont.
Yeah, Fremont. Yeah, Jefferson. Here, Glenhigh, and then this is Madison. It's just increased just slightly to 8, just over 8 per 10,000. So for the response plan healthcare and testing, this is the ICU occupancy. So similar to what the hospitals are reporting, we are seeing a slight decrease in overall ICU hospitalization. So right around 57% of our ICU capacity is being utilized right now. That's probably a much needed break where they were up into the high 70s and 80s at times as they're preparing. Overall hospital occupancy, a slight increase really over the last just a little while, but again, floating just a trending slight upward, but again, we're hovering right in that 50% where it normally does, fit the 50 percentile range. And then our percent positivity, you can also see that a percent positivity really corresponds with number of cases that we see. So that first half of August, you can see our percent positivity of tests really actually increasing, with a decrease towards the end of the month that we're seeing. A slight increase in the last few days. This is a moving 7-day average. So we'll want to monitor that, how closely. Sometimes that can be done by the number of tests, and if there was just a high, maybe slightly higher, and then positives, but slightly lower denominator can increase the percent positivity. But again, we'll monitor that over the next week, that trend, we hope, will turn down again. And as Jerry mentioned, we're hopeful that might be able to have on a per county basis. I will say, if we do that, just due to the small sample size in some areas, just kind of what I mentioned, the state has indicated that they will not release information that is less than 30 tests. If a county has done less than 30 tests, we will probably not have that rate per county, for that county, I should say.
And we probably will see that for at least Clark County for sure.
Yeah. So, as mentioned earlier, COVID-related deaths by date, you can see on the very left side, that's our first death that we had in our health district back in June 13th, actually. We did not have another one until the 19th of July. And really now, in the end of August, we're seeing, really since the 12th, we're seeing, 11 deaths just, in the last 10 days to 2 weeks. So we do know that this, while looks insignificant on this paper, potentially these are individuals that, as Dr. Krell spoke, would still be within our community if not for COVID today. As well as it just goes to highlight that we do see the deaths after the cases at times, where the medical providers are doing their best to help keep those individuals fighting and recovering. So deaths by age, again, this affirms really what the CDC is seeing with age groups, but also with comorbidities. As we age, we tend to have potentially more comorbidities or underlying health conditions. Our deaths within our health district have been, as of right now, as reported to Eastern Idaho Public Health, really above 60. So you can see 60, 70, 80, and then one individual in their 90s. So as Dr. Krell mentioned, he did have an individual that passed away in their 30s. We really wait until the electronic death report is reported through the state. We're not a diagnosing agency in the fact that we report what the electronic death record says. So that's done by both providers and potentially the coroner.
Does anyone have any questions? Okay.
I don't see any. Appreciate all the information. It has been incredible, the amount of information that you continue to pump out and that it does through social media and other sources. So I think it's really kept everybody up to date. Board members, any questions before we move on? So the next item of business.
Brian?
Yes, go ahead, Commissioner Miller.
I just have a question. It was brought to me, and it kind of relates to COVID, but it's also about the influenza and that, you know, the issues that may come from that coming up. And I know the county has asked if the health district's going to be providing influenza shots here in the near future.
That's a great question, Commissioner Miller, and the answer is yes. We anticipate getting an adequate supply of the flu vaccine within the next couple of weeks to be able to begin offering flu vaccinations. We're going to be doing things a little bit different than we've been in the past as well, and we'll be practicing a drive-through flu shot clinic here at the health district with our employees. Kind of fine-tune that so that we can do that to the broader public going forward to really try to minimize close interactions with individuals and maintain that physical distancing. But the answer is yes, we'll be doing the flu shot clinics here very soon.
Thank you.
I had a question on that as well, Jerry, yesterday, just because I saw a provider was starting to advertise them. Is it best to get it as early in the season as possible, or do you worry about it wearing off before the season is done? What's the best timing?
I'm going to let James reply to that.
So certainly the recommendation is, and as Dr. Krell mentioned, they are starting to see, you know, influenza diagnosis inside the hospital and through their emergency department. We recommend that as the vaccine becomes available to receive the vaccine. So if the vaccine is available, it is an appropriate time to receive that, because flu does circulate. We commonly think kind of more in the winter, but it does start throughout the year really, but really starts peaking at different times. So it's appropriate now.
Okay. Thank you.
Mr. Chairman.
Yes, go ahead, Commissioner.
Just follow up with Jerry on that. Well, you mentioned that we'll be doing those shots there. Is that in all the outlining offices or just Idaho Falls?
We will do them in all of our counties. What specific plans we have for each individual office is still on the works, but we will communicate that with you as soon as we have those details available.
Okay, thanks.
Any other questions? All right, we'll go ahead and move on to item 6 then on our agenda. This is an action item. It appears that because of that outbreak in Mackey, that Custer County has risen above the metrics. So you want to explain that, Jerry?
Yes, Mr. Chairman, thank you. As you just mentioned, starting Friday of last week, so August 28th was the first day that Custer County, they had been around a rate of 7 per 10,000 population. And last Friday, they jumped up to 27.8. Since that time, it has continued to increase to 30.1, 30.1, 37.1, 34.8, and as of yesterday, 37.1. So for 6 days, they have been above the metric that would move them into the moderate risk level. I will share that we are seeing cases. We know Custer County is geographically separated, but we are seeing cases both in the Chalice area as well as Mackey area. Our proposal or recommendation is that the order that we're considering today be effective for the entire county. For Stanley, while they have not had any cases there, they do have children that go to school in Chalice that could actually present a risk back to the Stanley community. So as we've done with other counties that have had increased active case rates, we are proposing to you today to implement the order of restriction for Custer County. It is the same order that we've had in place for all of our other counties that have been under those restrictions in the past or currently. Again, I would review this with the board if that's all right, simply because if we have people from Custer County on, they may not be familiar with what we have done in other counties. The introduction just talks about specifically COVID-19, and that we know that people that may not be showing symptoms can spread the illness to others. It includes the recommendations that public health has been sharing from day one of other mitigation strategies that we want everyone to be practicing day in and day out. So washing your hands, staying home when you're sick is of utmost importance. Keeping physical distance between yourself and others outside of your immediate household. And when that can't happen, to wear cloth face coverings when you're in public. In addition, bringing groups of people together is a high risk activity. And so this order does include some restrictions on gatherings. So we'll talk about that specifically. Oops. I see an error here in the header, which would be today's date. So I'll make that correction if it's approved. But for the gatherings, to enable to maintain the 6-foot physical distancing between participants at social gatherings events, the requirement would be to allow for 28 square feet per person. And that is based on the area in which the participants would be seated or positioned. So for example, in an auditorium, it would be the seating area that they would base that capacity off of. And then it also provides that organizers of the events need to make sure they maintain physical distancing at all their locations within the event. So at the ticket booths, the entrances, exit, restrooms, concession stands, where people would naturally tend to congregate, to have plans in place to ensure the physical distancing is maintained. The second piece of this order, again, does require face coverings to be worn in public when one is outside of their immediate family members and they cannot maintain physical distance of 6 feet between themselves and others. The face covering, it does say that it needs to completely cover the person's nose and mouth. And That's what we consider wearing it appropriately, that it does cover the nose and the mouth completely. Gives a description of what a face covering is. It could be a cloth face covering, or it could be the procedural masks that we see, more the medical grade masks. Those are fine as well. And it describes public place. There are exemptions included in the order for those that are not required to wear the face coverings. That is for children under 2, people with mental health conditions or disabilities that prevent them from wearing a face covering, people that are hearing impaired, or people that are communicating with people that are hearing impaired, where it's imperative that they be able to see the person's mouth. Law enforcement officials could be excluded if it creates a risk to their body. People obtaining services involving the nose, face, or head. For example, a dental appointment, obviously you can't have your teeth cleaned if you have a mask on, and so it does provide a exemption for that. And then eating and drinking at a restaurant, the face covering can be removed as long as the people are seated at the table. If they are moving amongst the facility, the requirement would be that the face covering is worn. And then the last exemption would be for people that are actively engaged in competition, training, or practice that involves strenuous physical activity where a face covering is not feasible. Again, the intent of this is it really is only the athletes themselves. Other people, for example, coaches, or people that are maybe on the bench of a game would be expected to wear the face covering. But those that are actively engaged in the physical activity would be exempted. In here, it does request that all cities and the county post this order of restriction in their facilities, and we as public health do publish it online. We certainly will share it with all of our partners within the community to help the public be aware that the order is in place. As has been our practice, the order would be in effect for a minimum of 2 weeks. That is 1 incubation period. And then in addition, to be able to return to the minimal or the green risk level, it would require a county be underneath the active rate for Custer County specifically, under the rate of 15 per 10,000 for 7 consecutive days. So we review that every single week, and we'll bring those recommendations as they occur to the board.
Are there any questions from board members?
Mr. Chairman,
Go ahead.
if I could, one point of clarification for any in the public that might be there. Jerry, that 7 consecutive days under the metric, is that 7 days from, I know what it is, but I wanted to clarify, is that 7 days from the day of the order, or is it 7 days from the day that they first went under the metric?
7 days from when they first went under the metric, 7 consecutive days. And again, it has to be at least 14 days. So if at day 7 of the order, the county went below that metric, they would still then need to be 7 more days to meet the 14-day minimum, as well as the 7 consecutive days.
Okay, thank you. Just wanted to make sure. I mean, I knew that, and I just,
No, thank you for that.
Okay.
Good information. Is there other questions? I know, we are hopeful that those case numbers can go down. We would love to see Mackey School District be able to get back in. I know that's their desire as well. So anything that would help that, I'm sure would be appreciated. Commissioner Butts, any comments?
Well, and I said this in the very beginning, this is, it's always easy for me to tell everybody else to put a mask on, meaning other counties, until it comes to your own county. I'm frustrated with the fact that I have heard rumors that management in our assisted living facilities told some of their staff members that even though they were sick, they needed to come back because who was going to take care of the patients or the residents if they weren't there. I have always gone to our PAs. We have 4 young PAs that have been a huge asset in our community, and asked them for their opinion. And a couple of weeks ago, they said that Custer County is unique. It's easy to do self-distancing from Chalice to Mackey or Chalice to Stanley. And at that time, they didn't feel that we needed masks. And a couple of weeks ago, I went in to their lunch meeting and asked the question again. And every one of them was frustrated with the fact that the community, as far as Chalice, has held street dances, has had events with multiple bands, where there was no possible way for self-distancing. And so they, it just seems like they don't really care. I think the mentality is herd immunity is what it's going to take. Just like they do with the livestock, they vaccinate and isolate those ones that are sick away from the ones that are healthy until they can easily get herd immunity. I think the ones in this community that are wearing masks are the ones that are going to wear masks. I don't think that even with an order, you're going to get any new ones wearing masks, which could be unfortunate. We all want to see our schools stay open, yet it seems like we don't want to practice safe distancing and things that could allow us to do that. I really feel that even if the governor at this point was to tell everybody that you needed to shut down bars and all that, I don't know in Chalice that they would even honor that. I think it's going to be a challenge. I think, as I said in the very beginning, that if Chalice was to have 3 deaths within 5 or 7 days, that we'd probably go block the highways off like we did in 1918. But, we'll see what happens.
Mr. Chairman, may I make a couple of comments?
Please.
I will tell you that in working with the assisted living center, that they have restricted visitors to their facility. And we have been in communication with both school districts because the order does apply to school children. So we have been in communication with the superintendent of the Chalice School District as well as the Mackey School District, and have been providing information to them as we've been preparing for this order.
Okay, that's great. And I know you're always great about communication with the mayors and all of the leaders in the various counties and cities. Yeah, I just think it's all we can do as public health is provide what we believe is necessary, what is proven to be necessary and helpful in other counties and areas. Because we want to see them be able to get, as I said, back in school, we want to see all those businesses stay open. We just want to keep these numbers down so that they can continue with these activities that they desire. So that would be our hope. We have a recommendation from our public health that they believe will help with that. And so it's our responsibility whether we want to adopt it or not. Is there any other questions from the board? If not, I'd be ready for a motion.
Mr. Chair, this is Bill Lake. I make a motion that we approve the order for Custer County as presented.
Thank you, Mr. Lake. Is there a second?
This is Commissioner Shenton, I'll second it.
Okay, there is a motion and a second that we adopt the order for Custer County similar to our others, and it would become effective immediately. Is there any discussion? Hearing none. All in favor, say aye.
Aye.
Is there anyone opposed? And did anyone abstain?
Commissioner Butts abstains.
Okay, so we have one abstain from Commissioner Butts. We appreciate that. We will go ahead and ask East Idaho Public Health to go ahead and issue that. Then I see no other business on the agenda. Is there anything that one of the board members needs to bring up before we close?
Mr. Chairman,
Go ahead, Commissioner Shenton.
just a question maybe, what's Butte County doing? I know they some of those kids go to school from Mackey down there or vice versa, but where are we at with Butte?
Mr. Chairman, Butte County has definitely seen an increase of cases as well. I've been in communication with Maggie Mann, the director at Southeastern Idaho Public Health. Butte County themselves took action for some restrictions on their county. It did not come from the Public Health Board, but rather the county themselves. But we're watching that closely, again, concerned the close proximity and interaction. So I would say that makes this order even that much more important.
Okay, thank you.
Good question. Are there
Mr. Chair, This is Bill Lake.
Go ahead, Bill.
I have a friend in Butte County that's the president of their ambulance district there. And he told me that they're really hurting for people because they're a volunteer ambulance operation, that some of the people up there have been affected by the COVID, and so they're down on their numbers to be able to respond to calls.
Okay, thank you, Bill. All right, seeing no other questions, I do appreciate the time that everybody has taken this morning. I know the time has been a demand on the board and most particularly on all our staff at East Idaho Public Health. We appreciate each one of you. There is a comment section, an email on the website of East Idaho Public Health. If there was questions came up from any of the public today that they would like an answer to, they can submit that question on that portal. Again, thanks to all of you. Hope you have a good day, and we'll call this meeting to a close. Thank you.
Thank you all.
Thank you.
Thank you.